Run your tongue along the very corners of your mouth right now, where your top lip meets your bottom lip on each side. Go ahead. I will wait. If you feel a little soreness there, a tightness, a tiny split in the skin, or a raw spot that stings when you yawn or smile too wide, then please stay with me, because your body may be trying to tell you something important. Those small cracks at the corners of your mouth are not just dry skin, and they are very often not the cold sore most people assume they are. In medicine, we have a name for them. We call it angular cheilitis. And for many people over 60, those two little cracks are a quiet message from the inside of the body, a sign that something deeper is running low or running off track. Sometimes it is a simple vitamin, sometimes it is iron, sometimes it is blood sugar, and sometimes it is something as ordinary as the way your dentures fit. Today, I am going to walk you through every one of those reasons in plain language so that the next time you look in the mirror, you will know exactly what those corners are trying to say. I am Dr. Daniel Mercer. For more than 18 years, I have practiced internal medicine, sitting across from patients who came to me worried about one small thing, only for that one small thing to lead us to something we truly needed to catch. The body is honest. It shows us signs on the outside long before we feel sick on the inside, and the corners of the mouth are one of the most overlooked signs of all. So if you have been dabbing cream on those cracks for weeks and wondering why they keep coming back, relax your shoulders, take a slow breath, and let me explain what is really going on. Before we go any further, if you find it helpful to have a doctor explain these things slowly and simply, the way I would explain them to my own mother, take one quick second to like this video and subscribe to the channel. It is free, it takes a moment, and it helps me reach more people over 60 who deserve to understand their own bodies. Thank you. Now, let us get into it. Let me start by telling you about a patient of mine. I will call her Dorothy. Dorothy was 71, and she came to see me not about her mouth at all, but because she had been feeling unusually tired, the kind of tired that sleep did not fix. As we talked, I noticed the corners of her mouth were red, cracked, and a little crusted. I asked her how long they had been like that, and she waved her hand and said, "Oh, months, doctor. It is nothing. I just keep putting lip balm on it." But to me, those corners and that deep tiredness sitting side by side told a story. We ran some simple blood work. It turned out Dorothy was low in iron and low in vitamin B12. The cracks at her mouth were not the real problem. They were the warning light on the dashboard. Once we treated what was actually low, her energy came back, and yes, those stubborn corners finally healed for good. That is why I never wave away a sign like this, and why you should not either. So let me explain what angular cheilitis actually is, because once you understand it, everything else will make sense. The corners of your mouth are a special little spot. They are warm, they fold in on themselves, and they tend to stay damp. Whenever you eat, talk, or sleep, saliva can pool right there in those folds. Now think about what happens to a corner of a wooden windowsill that stays wet all the time. The wood softens, it breaks down, and eventually it cracks and splits. The skin at the corners of your mouth is no different. When that little area stays damp and irritated for too long, the skin softens, breaks down, and splits open. And once it splits, the door is open for two unwelcome guests to move in. The first is a yeast called Candida. The second is ordinary bacteria. Both of them love a spot that is warm, moist, and broken. That is why these cracks can sting, turn red, and refuse to heal no matter how much balm you apply, because cream alone does nothing to fix what is feeding them. Let me give you another picture, because I want this to stick with you. Imagine a small leak in the corner of a ceiling. You can paint over that stain again and again, but until you climb up and fix the pipe that is leaking, the stain comes right back every time. The crack at the corner of your mouth is the stain on the ceiling. The leaking pipe is whatever is going on deeper inside your body. If you only ever paint over the stain with cream, you will be painting forever. The lasting fix is almost always up in the pipe, on the inside. Keep that picture in your mind, because it is the single most important idea in this whole video. Now, here is the part that truly matters, and it is the reason I made this whole video. The crack you see on the outside is usually a clue about something happening on the inside. Let me walk you through the most common reasons one by one, so you can begin to think about which one might be yours. The first, and one of the most common, is a shortage of B vitamins. Your body relies on a family of vitamins called the B vitamins to keep your skin, your nerves, and your blood healthy. The ones that matter most for the corners of your mouth are riboflavin, which is vitamin B2, along with B3, B6, and B12. When you run low on these, one of the very first places it shows is the thin, hard-working skin at the corners of your mouth. Think of these vitamins as the maintenance crew for your skin. When the crew is fully staffed, they patch up tiny breaks the moment they appear. But when the crew is short-handed, the small splits at your mouth go unrepaired, and they linger for weeks. For many older adults, this happens not because they eat poorly, but because as we age, our stomachs absorb these vitamins less easily than they once did. Certain common medications can lower them too, so a cracked corner can quietly be your body's way of saying the maintenance crew needs more workers. The second common reason is low iron. Iron is what your body uses to carry oxygen in your blood. When iron runs low, a condition we call iron deficiency anemia, every tissue in your body gets a little less oxygen than it needs, and once again, the delicate corners of your mouth are among the first to show the strain. In fact, the medical literature has linked iron deficiency and other nutritional shortages to roughly a quarter of all angular cheilitis cases. That is a real published figure, not a guess. When I see cracked corners along with tiredness, pale skin, or shortness of breath climbing the stairs, iron is one of the very first things I want to check. It is a simple blood test, and it is often a simple fix. The third reason brings us to blood sugar, and this one surprises a lot of people. If you have diabetes, or even blood sugar that runs high without you knowing it, you are more likely to get these cracks. Here is why, and it is a tidy little explanation. Remember that yeast, Candida, that loves to move into a damp, broken corner. Candida feeds on sugar. When your blood sugar runs high, there is simply more fuel available for that yeast to grow all over your body, including the corners of your mouth. So stubborn, repeating cracks at the mouth can sometimes be one of the body's early hints that blood sugar deserves a closer look. I am not telling you that a cracked lip means you have diabetes. I am telling you it is one more reason worth mentioning to your doctor, especially if it keeps coming back. The fourth reason is wonderfully ordinary, and it is one of the most common of all in people over 60. It is the way saliva pools at the corners of your mouth, and dentures are often the cause. As we age, the natural shape and support of the lower face can change. Teeth are lost, dentures may no longer fit quite the way they did, and the corners of the mouth can begin to fold inward and downward. When that happens, saliva collects in those deepened folds and sits there all day long, keeping the skin constantly wet. Remember our wet windowsill. Constant dampness softens the skin and invites that yeast and bacteria to settle in. This is why a dentist is sometimes the most important person to see for a cracked mouth, not for the crack itself, but to check that your dentures fit correctly and are not creating those moisture-trapping folds in the first place. The fifth reason is simple dehydration and dry, chapped skin, especially in dry weather or cold months. When the lips and the skin around them dry out and you lick them to soothe them, you actually leave them wetter and then drier than before, which only deepens the cracking. It is a little like washing your hands over and over on a cold day. Each time they feel better for a moment, and then they end up rougher and more cracked than when you started. The same thing happens at the corners of your mouth every single time you lick them. Many of my patients over 60 do not feel thirsty the way they used to, so they quietly drink too little throughout the day, and their skin, including the delicate corners of the mouth, pays the price. There is one more thing I want you to understand about why this matters more after 60 than it did when you were younger. As we age, our skin becomes thinner and slower to repair itself. The little patch jobs your body used to do overnight now take longer. At the same time, our sense of thirst fades, our stomachs absorb nutrients less efficiently, and many of us are taking one or more medications that quietly affect saliva or vitamin levels. So a sign that a younger person might shrug off in a day can settle in and linger for weeks in an older body. That is not a reason to worry. It is simply a reason to pay attention and to act a little sooner rather than later. So now you can see the pattern. The crack at the corner is the outside sign. Behind it may sit a low vitamin, low iron, high blood sugar, ill-fitting dentures, or simple dryness, and sometimes more than one of these at the same time. This is exactly why I want you to think of these cracks not as a small annoyance to cover with cream, but as a gentle knock on the door from your own body. Now let me show you what to actually do about it, step by step, because understanding the why is only half the battle. First, keep the corners clean and dry, the opposite of the damp little swamp the yeast loves. After you eat or drink, gently pat those corners dry with a clean tissue. Do not lick them, no matter how much you want to. Licking feels soothing for a second and then makes everything worse. Second, protect the skin with a simple barrier at night. A thin layer of plain petroleum jelly or a gentle, fragrance-free ointment at bedtime can shield the corners while you sleep, when saliva tends to pool the most. This protects the skin so it has a chance to heal instead of staying wet all night. Third, and this is the big one, look inward, not just outward, because the real cause is so often on the inside. The most important step is often a simple conversation with your doctor and a basic blood test. Ask them to check your iron, your B vitamins, particularly B12, and your blood sugar. These are common, inexpensive tests. If one of them comes back low or high, treating that underlying cause is what finally makes the cracks heal and stay healed. Fourth, if you wear dentures, have your dentist check the fit. This is not vanity. A denture that has loosened over the years can be the entire reason those corners stay wet and broken. A small adjustment can solve a problem that creams never could. And while you are there, ask your dentist to clean your dentures thoroughly and show you how to care for them properly, because that same yeast can live on the dentures themselves overnight and reinfect the corners of your mouth the moment you put them back in each morning. How often should you do this home care, and for how long? Keep up the gentle patting dry after meals and the thin barrier at bedtime every single day, and give it a fair chance to work for about 2 weeks. Most mild cases that are simply about dampness and dryness will begin to improve within that window. But if you reach 2 weeks and those corners are no better, or if they heal and then keep coming back, that is your clear signal that the cause is on the inside, and it is time for that blood test and that conversation with your doctor. Do not keep repeating the same home care for months and hoping. 2 weeks is your checkpoint. Now let me tell you the common mistakes I see, so you can avoid them. The first mistake is treating it like a cold sore. A cold sore is caused by a virus and usually appears as a blister on the lip itself. Angular cheilitis sits specifically in the corners, in the fold. They are different, and the creams for one will not fix the other. The second mistake is using lip balm over and over and expecting it to cure the problem. Balm can soothe dryness, but if the true cause is low iron or a yeast infection, balm alone will never close that door. The third mistake, and the most important one, is ignoring it for months, the way Dorothy almost did. When a crack at the corner of your mouth keeps coming back, or simply will not heal after about 2 weeks, that is your body asking you to look deeper, not to buy a bigger tube of cream. Let me give you the safety part now, because it matters, and I always promise my patients honesty. For most people, cracked corners of the mouth are not dangerous, and the steps I just gave you are gentle and safe to begin at home. But I want you to see your doctor rather than waiting it out, in a few specific situations. See your doctor or dentist if the cracks have lasted more than 2 weeks despite your best efforts. See them if you also feel unusually tired, look pale, or feel short of breath, because that can point to low iron or low B12. See them right away if you notice spreading redness, warmth, swelling, pus, or a fever, because that can mean the infection is taking hold and needs proper treatment. And if you have diabetes, please mention these cracks to your doctor, because they can be an early sign that your blood sugar needs attention. None of this is meant to frighten you. It is simply meant to help you know the difference between something you can soothe at home and something that deserves a professional set of eyes. Now let me give you the one habit that turns all of this into something you will actually keep up. Tie the simple care to a moment you already have. You already brush your teeth at night, so let that be your signal. After you brush, you pat those corners dry and dab on your thin barrier of ointment. You are not adding a whole new task to your day. You are attaching a tiny healthy habit to a moment that already exists, and that is how habits truly last. And here is a small bonus that stacks right on top of everything else. Build your plate with the very nutrients those corners are crying out for. Lean meats, eggs, leafy greens, beans, and fish are all rich in iron, and the B vitamins that keep the skin at your mouth strong and quick to heal. So as you support the skin from the outside with care and protection, you are also feeding it from the inside. The two work together, and neither one costs you anything but a little attention. Let me bring this all together for you. Those small cracks at the corners of your mouth, what we call angular cheilitis, are rarely just dry skin. they are a sign. Behind them may sit a shortage of B vitamins, low iron, high blood sugar, dentures that no longer fit, or simple dryness, and sometimes several of these at once. You can care for the corners at home by keeping them clean and dry, protecting them with a gentle barrier at night, and never licking them. But the real healing usually comes from looking inward, with a simple conversation and a basic blood test from your doctor, so you can fix the true cause instead of forever chasing the symptom. Your body gave you this sign on purpose, right there in the mirror where you could not miss it. All it asks is that you listen, and that you bring what you see to someone who can help you read it. If this helped you understand your own body a little better, and you would like more simple, honest explanations like this one, please subscribe and stay with us here. This channel exists to help you read the signs your body is showing you, so you can stay strong, healthy, and independent well past 60. I would be honored to keep walking through these things with you. Take good care of yourself, and I will see you in the next one. And one quick, important note before you go. This video is for general educational purposes only, and it is not medical advice. Everyone's body is different, so always speak with your own qualified doctor or dentist before making changes to your diet, your routine, or your care. Bring what you learned here to them, and let them help you use it safely and well.